Hi, welcome to ACP's Wellness Wave, brought to you by ACP Southern California Region 3 Medical Student Committee. My name is Alex Malouf, and today I am so honored to interview Dr. Weber. Hi, Dr. Weber, how are you doing today?
I'm good, Alex. Thank you. Happy to be here.
So happy to have you here with us, all the way from Iowa.
Yes.
So do you mind sharing with our audience a little bit about yourself and what you do?
My name is Andrea Weber. I am a native Iowan. I currently practice in Iowa. I am a board certified internal medicine physician, psychiatrist, as well as doing addiction medicine. And I work at the University of Iowa Hospital, where I am a clinical assistant professor, primarily focused on addiction medicine and helping out with our addiction medicine fellowship and our internal medicine psychiatry residency programs.
And do you mind telling our audience, how did you choose your career path in medicine and psychiatry?
You know, I think at the end of the day, when I went to medical school, I wanted to be the type of physician who could critically analyze someone as a whole being. And I grew to appreciate the behavioral and the psychological aspects of medicine. I began to care a lot about people who had mental illness of various spectrum. And I honestly really enjoyed internal medicine and the really thorough diagnostic training that you received in that field. And as I got to meet more patients in my clinical experience, I realized that there was that siloed effect that I think we all appreciate in medicine, where there'd be more integration of medical and psychiatric care, that a lot of patients would be benefited by that. And so that's what drew me to combined training. That's what made me feel that in order to be the type of doctor I wanted to be, that was ultimately the type of training I needed. And then I think the added benefit to that was, as I got into residency, I realized that I really enjoyed caring for people who used drugs or had substance use disorders, and having both an internal medicine training as well as a psychiatric training was a really great fit for that population. Both for their lack of access to those things, but then also the integration of both of those components into people who have substance use disorders.
You are a true gem. We definitely need more med psych doctors that want to treat the whole being. And that was very neat that you found your niche in also helping in addiction medicine. Mm-hmm. But some of us, we're still trying to figure out our career path and what we want to do, both medical students and residents. Do you have any knowledge or words of wisdom to share with them?
Absolutely. And I do not take any credit for this. Was stuff that was passed along to me when I was in the same situation. And I think it's still held true and it served me very well. Was first and foremost, paying attention to how you feel at the end of the day, depending on what type of work you're doing, what service you're on, and noticing whether or not you feel energized by that work or you feel exhausted by that work. And it goes beyond hours. It goes beyond, if I, for example, were to do surgery for 12 hours and I leave work just feeling like that was great, paying attention to that feeling, versus if I was in clinic all day for 8 hours and I left work and being like, oh my goodness, it's going to take me 2 days to emotionally recover from that. You know, paying attention to that feeling and picking something that will be able to provide that intrinsic value and motivation throughout, hopefully, you know, decades-long career. And it's different for everyone. I just think people just really have to pay attention to how they feel in those cases. And then the other piece of advice I have is to understand what the most common thing that person does in their job, whether it's the type of service they provide, the condition that they see, the type of chief complaint that they see. And again, figuring out, is that something that I could talk to people about all day long, potentially for the next, you know, few decades of my life. You know, most orthopedic surgeons I know, you know, they love knee pain, they love joint pain. Whereas maybe if you talk to someone who is a psychiatrist, they'd say like, oh my goodness, if I had to talk about knee pain all day, I don't think I could sustain myself in that. And so I think, again, what does this person do every, you know, most of their day in and day out? Is that something that would continue to energize me, keep me interested, something that I would love to continue talking about with my patients and educating them on? And hopefully you find a field that kind of has a good feeling of something that energizes you and keeps you interested and motivated, so that you can sustain yourself going forward.
That is excellent advice. And I really like the component where you mentioned about finding what is the common thing that area of medicine or psychiatry does, and figure out whether that kind of aligns with what your values or interests are as a student. So very wise advice. Now transitioning over to our wellness question, we wanted to ask you, like, how do you remain strong in difficult patient situations?
Oftentimes when I'm, in my field, right, when I'm caring for people who maybe have complex psychiatric and or medical needs, um, one of the initial responses that many of us have when we start to feel inadequate or futile, and sometimes that's a true feeling, sometimes that's maybe just a perception, but we oftentimes start to blame our patient. We start to assign them responsibility that might not be warranted, might not be fair, and ultimately just doesn't serve us or the patient, and it really poisons the relationship. And so when I think of difficult patient situations, I often think of situations where there's a lot of emotional tension, there's a lot of miscommunication, and oftentimes I center myself and I really say, okay, if I assume that this person is doing the best they can with what they have in this moment, how can I augment that? How can I supplement that? And I think oftentimes if we flip that and we think through that lens, it just naturally provides us with some empathy to the situation, and hopefully also some grace with ourselves to acknowledge that there's plenty of things about life and about someone else's life that we can't necessarily directly impact. But again, if we're doing the best we can with what we have in that moment and we maintain that empathy of the situation, I think that just ultimately results in a better outcome. And so I think, that's always my centering point, is just keeping myself honed into what I can achieve, but then also really knowing and trusting that this patient is doing what they can, but sometimes in that moment it's just not what's needed, or it's, if they had other tools that they would use them at that point, but at this point they just don't have them at their disposal.
Love that. I think that gives us a lens of how to be really empathetic with our patients. Transitioning over now to our wellness question or wellness quote. Do you have something to share with our audience?
When I think of, I was thinking about this as far as what I would consider my wellness mantra. And I think ultimately what it comes down to is that sometimes the best thing we can do for our patients is to hold a safe and empathetic space. And that space is sometimes more effective than medicine. It's more effective than the procedure that maybe we wish we had. And at the end of the day, that is enough, and it should be enough. We should be able to walk away from that day and say, I did my best for that patient in that moment.
Thank you. Here's a bonus question I'm going to throw at you. So the question we have is about advocacy and the relationship with advocacy and wellness well-being, as I know that you are a strong physician female leader and a great advocate, and as well in ACP.
I have not been practicing medicine for a terribly long time, but what I've realized is there's a lot of stuff day to day that I can't impact about the greater system, but I have been granted a lot of privilege in the fact that I am a white, well-to-do female that has these special letters MD after my name, and that because of that, people decide to pay attention to me. And how can I leverage that power to really advocate for larger change that will hopefully to a greater degree impact my patients, but then also maintain future going forward. And so I do a lot of advocacy work as a physician. I work with a community organization that focuses on policy around drug use, policy around people who use drugs, really trying to bring in more evidence-based care. I also do advocacy work through ACP with our local state chapter, whether it's kind of talking about bylaws, talking about different things that we want to maybe make change and have guidance on, or ACP having statements on that will help guide even national legislation. And then because I also do psychiatry, I work with our it's called the Iowa Psychiatric Physician Society, or IPPS, which is our state chapter of APA. And I also do advocacy work within them and trying to figure out what laws are being passed. Should we be working with some of our stakeholders to draft different bills, to whether it's enhancing residency positions, increasing funds, changing how our structure is set up for people with mental illness. And I think that work is not something that comes naturally to any of us who necessarily practice medicine, but can be definitely learned, can be definitely taught. I've learned from a lot of great people inside and outside of medicine on how to do advocacy work. And I think it just keeps you feeling like I'm making greater change. It's small, it's incremental, but I'm participating as actively as I can instead of just maybe sitting on the sideline and feeling demoralized about maybe how our healthcare structure is set up, especially for our most vulnerable populations.
Well, thank you so much for being such an amazing advocate. And I also want to thank you for taking your time today to interview with us. I'm sure that our audience will benefit from all the advice and wisdom that you shared today.
Thank you. Thank you for having me. And I wish everyone the best of luck who participated in this